Hello everyone, welcome to the Life of Education podcast. Today we're here with Sunita Teckchand and obviously Keith.
Hello everybody.
Hi Sunita. So
Hi.
obviously thank you so much for coming today and for being on our podcast. So you'll be taking us through a pathology and conditioning course for a Life of Education in the coming few weeks. So maybe you can tell us a little bit about the course.
Sure. Basically, it's about pathology. I have seen that you have anatomy and physiology, which is quite basic and very interesting.
Yeah, that's actually with Keith.
Yes, it's really nice. I mean, I found it quite interesting, actually. It's made simplified, and that's what I plan to do for pathology class. Of course, our body has about 11 systems, and we're going to go through 4 systems in the first segment. We're going to start with the integumentary system, which is our skin. And I know that this course is about teaching for fitness trainers and Pilates and yoga instructors. And a lot of people don't realize sometimes that people have skin conditions that if they touch it, it could be fungal or viral, and they might be able to get it as a secondary infection. So, of course, we start with the skin because sometimes it's visible, sometimes it's not visible. Let's say if a physical trainer was to work on somebody's feet, or let's do some stretches or something like that, and the person had verrucas on their feet. Well, it's quite contagious, and we don't realize that it's a verruca because it's a really tiny little wart which has got a little black dot in the middle. So I think for me, I would like to teach them about pathology in a way that they can recognize these kinds of conditions when they're working with one-on-one or with a group of people, and to be aware that secondary infection can be quite large.
Yeah, well, obviously, Keith, you're a personal trainer as well, so you must see this a lot.
Yeah, I especially saw it when I was playing rugby, to be honest, with one of the guys showed up one day when we were quite young with impetigo.
Yes, that is very contagious.
And
What is impetigo?
so he showed up and he just said to the coach, you know, I have this, it looked like a bruise, but it was weeping. He's like, I have this sort of, we didn't know what it was because we were 16 or 17. And the coach noticed it and said, you have to stop, you have to go, you have to go see a doctor. That's, in rugby, it used to be, or nicknamed scrum pox.
Yes. Yeah, but that is it's a
Yes.
very
I think, like, if
contagious.
you just tip it, you get it. Is that something? Is it
Yes,
that
it is.
sensitive?
It is because it's like, for example, shingles, okay, which is adult chicken pox. I mean, you might notice it as bumps on the body, but actually it is quite contagious as well if the person hasn't had the 14-day incubation period and they go out and play rugby and somebody's touching them and they're, you know, how it is. And yeah, you can get it. And adult chicken pox, shingles, is one of the worst conditions to get because it's really itchy and you feel horrible and scratching and there's pus and blood oozing as well. So yes, I mean, that's really in a bad stage.
Yeah.
But some people get it because it's an adult chicken pox basically, but some people get it when they're adults, they get it really even worse than they got it when they were children. And I've seen a lot of this stuff, and the scabs get really bad. People scratch on it, and then they get marks and, you know, things that which then they need to go for laser treatment and all at the end.
And it can be quite dangerous as well. Like just actually having that. If as a trainer, if you notice a skin condition or as a yoga instructor or a therapist, you should, you know, there's a way to sort of diplomatically highlight it to the client and then make sure the client goes to get it checked out, because if that spreads, not only is it irritating, it can actually be quite detrimental to the health.
Well, you're passing it on to other people, and I think a person who realizes that maybe people don't know that this is contagious. They don't know that they go ahead and play games and stuff like the impetigo, because it can happen to anybody. The guy still turned up, right?
Yeah.
So
He didn't know. We were 16.
well, there you go.
Yeah.
Well, I think it's really important to pay attention, especially for the trainers, to understand certain skin conditions, and there are many skin conditions that we need to be aware of, especially if you're touching somebody. Because coming from my background, I touch a lot of people because I'm doing treatments, right?
Maybe you can tell us a little bit about your background first, but I've got a lot of questions about all of these conditions.
My background. Oh, that's a really long one, Caroline.
Yeah, well, I'm sure everyone would like to know.
Okay, well, I first started to study aromatherapy about 22 years ago, and I'm a clinical aromatherapist now with the IFPA. Also a principal tutor. I offer their courses, which is almost 2 years, the course to be a clinical aromatherapist. It's a full-on course, actually, and I feel more and more people are now inclined to be aromatherapists because a lot of people actually want to know what they can do after they retire. I'm getting a lot of women in their 50s actually at the moment wanting to do a course. I also am an external examiner, and this is just new now that I have been offered from the IFPA. So actually I go to Hong Kong, UK, Malaysia, Singapore, where I get invited as an examiner and then examine the students to, grade them for their evaluations and stuff like that, which is a great opportunity for me, I guess, without all the years that I've dedicated to aromatherapy.
Yeah, of course.
I'm also a clinical reflexologist. I study that as well. I studied kinesiology, touch for health, so we can actually muscle test a lot of people, and actually a lot of chiropractors and physiotherapists are doing applied kinesiology now. So it's another great tool to have. In the healing modality, I studied Jinshin Jitsu, which is the Japanese art of healing. Again, I work with clients in a way that I can help them with really severe conditions like critical labels, as we call cancers, MS, and so forth. I've also studied hypnotherapy. I'm actually one of the students of Dr. Brian Weiss with regression sessions that I do from his book, Many Lives, Many Masters. What else do? I do quite a lot of things still. I've missed out something, I'm sure.
So maybe you can tell us a little bit about some of the other courses as well. So you mentioned the 4 systems that you'll be going through.
Mm-hmm. So it's the integumentary system, and then we're going to go into the muscular, skeletal, and nervous system. So I'm following it as we start from outside the body to work inwards. And again, of course, in this kind of scenario where you need to have more knowledge about certain pathology as far as the muscular and skeletal system is concerned, because today, so I'll give you an example. I had a fitness trainer who used to come to my house, okay? And he didn't really even check what kind of condition that we were in, like, how fit we are, or can we be that flexible or jump up and down and do these burpees and, things like that. And I think after a while, just to satisfy him to say that, he's the expert, so let's do it, my husband and me, we actually got injured quite a lot of times because it was not, he didn't really check about what is our capacity. And I think that's not right, because you need to know the age of the person, the condition as far as the bones are concerned. My husband has a knee issue, so he keeps blaming that instructor, saying that because of him, my knees got really messed up. So he's had to go for injections and, things like that. We want to avoid things like this because...
Of course. Well, this is one of the reasons why Keith and I decided to do a life of education, because we were just noticing so many little things, and we wanted to give personal trainers an avenue to be able to expand on their education from anywhere on any device and really make it affordable and accessible. So this is how this all started. So we totally agree with you.
Yeah, it's true.
With that trainer, like from your own experience as a client now, what advice would you have to trainers to avoid the client having the same experience that you had?
Yeah, I mean, they need to do a consultation. They should have a form or something that explains and asks certain amount of questions. We're not saying do a full consultation, and ask the full lifestyle. But they should understand if the person has had any injuries, any surgeries, if they've had any condition that they feel or the weakness in their body, in their muscle somewhere. At least find out about that and give them the right kind of training program that works for the individual and not do the same for everybody else. And I think that's where I was lacking. But that was about maybe 6-7 years ago. I don't know how things are now, because we went to yoga now, my husband and me, so we're not doing all this jumping up and down anymore.
No more burpees.
No more burpees.
And how do you find the yoga?
I think it's absolutely brilliant. I have an amazing yoga teacher. She comes twice a week to us, and she's very careful with asking about injuries and are you all right and do you have any issues. Like I have a lower back issue, so certain postures I cannot do. So she will make me do something else. And my husband's got a knee problem. So she makes him do things that are not going to put too much pressure on his knee. So she's careful. And I think that's really nice to have that one-on-one. I mean, it's like me being a therapist. If I didn't do a consultation with a client, understand if they've had any pre-existing conditions or any surgeries or injuries, I'm not doing my job then properly, because otherwise how do I know, how can I treat that person in the context of their life?
Yeah, that's quite a valid point.
So with the pathology of the muscles, what kind of depth are people kind of going to experience when they go in, when they watch your course?
Well, as far as the muscular system, there are a lot of diseases in the muscular system. We've got, of course, all the different types of arthritis. A lot of people don't know they even have arthritis until they go and have it checked out with a doctor, or until you really get severe sharp shooting pains, and then you start feeling that your muscles and your skeletal system start bending, or you have a constant stinging sensation or pain. Because again, when you have something to do with the muscular system, the skeletal system kicks in, and so does the nervous system. So sometimes people don't know, oh, it's just a nerve, it's just some tingling sensation, it'll go away after I stretch my muscles or something like that. But there are a lot of issues with the muscular system.
So I'm really curious, what are some of the issues that you'll be covering in the muscular system?
Well, I have diseases like arthritis, rheumatoid arthritis, osteoarthritis, because that's a big subject itself on its own. There are things like rickets, for example, a person may be born with not the right kind of, like bow-legged people, and they can never actually straighten their legs. They can never actually straighten their knees. So we need to observe. And I also think observation is very important when you look at a person. When you're doing a consult, let's say at the beginning with them, to maybe create a program or a treatment plan for them, or an exercise plan. So arthritis is quite big. Then also we have a lot of other muscular diseases. I have a list in my presentation. I don't really remember it offhand, but it's a lot to do with irregular nagging, frozen shoulders, knee pain, shin splints, like sprains and strains and things like that. There's also a lot of curvature issues that we need to look at, because somebody could have in the skeletal system, let's say, kyphosis or lordosis. Many people have scoliosis. But how do you see that? Sometimes it's so minute that you don't know, and you give a posture or you do something with that person. In fact, of doing anything better for them, you're going to make the condition worse. So these are the kind of points that I'm highlighting, looking at the overall of what you guys have decided to do, because it's always the fitness trainers, the Pilates teachers, yoga teachers that are coming forth, right? So they would need to know and observe their clients' postures. I think is really important as well.
Yeah, you talk a little bit about that in the anatomy and physiology.
Yeah, we come at it on that course from a sort of postural adaptation to what people are doing. So, sitting at a desk all day, or lack of movement, rather than a disease kind of angle. But yeah, I mean, posture is huge. You can tell when you get good at it, you can get really astute at identifying postural sort of abnormalities and little tightnesses here and there and little weaknesses here and there. But if you don't know what you're looking for to begin with, it's quite difficult. And when you're on the courses, the kind of the PT courses and the yoga courses, you get all the information very quickly in the space of however long you're doing your course. And then you go out into the industry and you kind of, there's certain bits you withhold, and there's certain bits that your memory just can't maintain. So that's where these courses are going to be really great for people, just to see, just to refresh the stuff that it's in their minds. These initial courses are really good for people, but they forget how to identify, when you're looking at someone for the first time, take an extra couple of seconds to see how their ankle posture is, how their knees, look, where their hips are, where their back is. And then, because from there, then the exercise prescription can really get quite effective for people. But if, like you kind of experienced, if they just are started off at a certain arbitrary level of exercise intensity, it's only a matter of time before things start to degenerate and get tight and get stiff, and the body is not going to like that.
Exactly. I think another very important aspect is spondylitis, because everybody is so mobile phone crazy now. So neck is one of the biggest problems. So you'll see the cervical spondylitis on a lot of people, and they have no clue that they have it. It just feels like a nagging pain on my neck, and you're constantly putting back and forth.
Maybe you can explain to everyone what that is.
Well, spondylitis is basically a trapped nerve that happens on maybe the C4, C5 vertebrae, and then it comes start getting the tingling sensations down your arm. Same thing can happen on the lower back as well if a person's sitting for too long. You've got spondylosis, which is in the back, where again, it's L4, L5, maybe it's a pinched nerve, and then you start getting these shooting pains down the leg. This happens because people are constantly sitting on their desk and on their phone or they're on their computers. And so many muscular problems in the fingers as well, because you've got, we go like a finger that gets stuck because you're using it constantly, or the phalangeal, the thumb, for the
Cramps.
mobile phone.
Yeah, I definitely.
So there's a lot. There's so much
Thumb
to
cramp.
cover.
Yeah. So we've got the skin, the muscles, the bones,
Skeletal, yeah.
and then the last is the nervous system. So what are some of the things that you discuss in that lecture?
Well, in the nervous system, I mean, again, it's observation. I'm not saying that people can just suddenly come with tremors or shakes or tics. These are all part of the nervous system. Something like we touch on cerebral palsy. We also touch on ADHD because this is all coming from the brain. How do you know if the person has the kind of condition? Because sometimes you cannot even notice it. Or can they understand what the trainer has told them? Have they assimilated what the message is into their brain? So there's a lot of people with very mild ADHD as well, where they are unable to comprehend certain things. So again, through observation and understanding of this disease, will we know how do we treat people like that? They're obviously under a special, category as well.
Well, it would definitely impact what type of exercises you would give them.
Yeah. If you know their
right?
condition.
Yeah.
Yeah, well, I'm trying to think now if I've ever experienced somebody who's in the consultation has said, I have ADHD, and then from there we've been able to factor that into the training. It's not something I have too much experience with, but I understand what you're saying when you talk about like how people assimilate the information that you're describing when you are talking them through a brand new exercise, because people learn completely different ways.
Exactly.
People learn, they want to see you do it, or they have to listen to it, or they have to do it themselves, or they're just not very coordinated with these new movement patterns, so they take a while and then they get frustrated.
Exactly.
And it's like, and then they don't want to do anything, and it's, well, not that they don't want to, but they're uncomfortable immediately. So I think there's definitely a fine art. That's almost where the coaching skills come in, because that's where, if you're teaching someone a movement, the way you teach this person will be different to the way you teach the next person the same movement, just because people's brains absorb information very differently. So that's going to be very interesting for people. What advice would you give, or how does the presentation offer people support to take them?
Well, basically with pathology, it's difficult to notice, but there's certain questions that you can ask someone, or certain exercise. Have you ever heard of brain gym or something like that?
Yeah.
Where
I
you
have.
can do opposite, and that's where and since you're fitness, you can say, hey, I'm going to teach you something, see if you can follow me through. Many people cannot do it. And if they cannot do it, that means the right and the left brain is not functioning at par. And that's a very simple test to do to find out.
So what example, what test or what exercise would you
Do you want me to get up and show it to you?
Well, can you describe it for the people listening?
Well, first of all, you can stand straight and then just hold, tap your right knee, and then use your left hand to tap your left knee. And then you go opposite, and then you go opposite behind. A lot of people can't do the opposite behind because they get confused as, what's opposite behind? And it's a very small little thing, and that itself gives you an indication as to something about the assimilation of certain instructions.
Yeah, that's great. I like those little tests. I think each coach eventually finds their own little craft. They find their own little tool. I have a particular type of warm-up movement pattern that I'll take people through that involves arms and legs and moving through space. And I can tell we'll have a consultation with somebody, and it could be, for example, a middle-aged guy who works at a desk, but he plays tennis twice a week, and his history is good. He's played a lot of sports in the past, and I'm sort of drawing a picture of someone who's relatively coordinated. They've got an athletic background, and then we get up and we do these things, and there's no control. And I think,
exactly.
Okay, so what's on paper is very different to what's being presented.
Yeah, exactly.
So then you get an idea. For me, that's kind of my way of knowing, okay, now I sort of know where to pitch this client in. I can't do the box jumps, the burpees, but I don't need to start this person at kind of level 0. So having a whole battery of those kind of courses, assessment tools is great for people.
Yes, it is. I mean, there's a lot of things like sciatica, for example. It's also part of the nervous system. So what do you do if you have sciatica with a client? Or he doesn't know, he just says, I got pain in my leg. How do you assess that it could be sciatica? Also, people could be having MS. Let's talk about sciatica first, okay? So sciatica, again, some people don't know that they have it because maybe their lifestyle is sitting too much on their chair, working on the computers, or they did some wrong move and something happened that the sciatic nerve got inflamed. Of course, if the nerve is inflamed, it's going to be very, very painful for the person. And a lot of times people then go to physiotherapy or chiropractors to get this kind of, get it moved basically because it won't pinch anymore. But you can even have mild sciatica without even realizing that you have it. So I think it's important for fitness trainers and all to understand these kinds of diseases because you do so much postural stuff when you're doing yoga, for example. And it does help. There are certain postures in yoga that are amazing for releasing that sciatic pain. But then there are also postures that can put added pressure on that as well. So how do you go about doing that?
Yeah.
So besides sciatica, you also have a multiple sclerosis, right, which is MS. Again, MS is one of the other conditions which is almost very impossible to even identify that the person has it. And they don't realize why they're weak, their muscles are weak, why they feel so fatigued, so lethargic, and so forth. So how do you detect something like that then?
So maybe you can tell us, how would you?
It's difficult because with MS, you have to, again, do a consultation to find out what kind of problem the client is going through. To see, again, coordination, I think, is one of them, which is very important.
Muscle strength.
Yes, you can do some kinesiology to, go resist against certain muscles. People don't know that they have it. And then by the time they get the diagnosis, it's already quite late because it's the myelin sheath that is in the nerve that starts to wear away. It's a degenerative condition. And so many people, when they have it at the very beginning, they feel symptoms of it. They think it might be. But in the real world, out there when you go to doctors, they are not able to diagnose it.
So if somebody does your course and they go through the whole process of learning all about this, what do they do after? Say they can notice that a client has ADHD. What do you do? Because obviously as fitness professionals, you can't diagnose people.
We're not allowed to.
Exactly.
Yeah.
So what would be your advice to people after?
Well, then you have to make a treatment program which is suitable for that person. I mean, that's the whole thing at the end, and not to make mistakes as to give them something maybe they are unable to coordinate with. I mean, that would be coming through people like yourselves who are fitness trainers, yoga instructors, Pilates, to then understand what kind of treatment program that I can give this person then to be able to support them in the best possible way and not to push them. Because a lot of people, when they cannot do something and you push them and everybody else in the class is doing it and that person is not, then what happens to that person? It goes into another realm again of I'm not good enough or I can't do it. Why?
I think what's important as well is to understand that the person has it in the first place, and that comes from the consultation, doesn't it? So
exactly.
A thorough consultation and almost like a welcoming consultation, going, look, if you have these things, it's fine. Here's what we can do. Don't let it put you off. Don't let it demotivate you. You know, in the class, this person might know how to do it. You're brand new. You'll pick it up eventually. But it's also I think the consultation is the most important part because the client needs to know that the trainer is aware of the situation. So then the client has at least the reassurance that the trainer is factoring in what I've just told them. So I'm doing this exercise. This trainer knows I have this situation. So I'm going to presume that this is a safe exercise for me. Whereas if you haven't had that discussion and now the client is doing something and they haven't told or
disclosed it.
Now they don't know that, is this good for me? He doesn't know or she doesn't know that I have this thing. So I think the consultation is so important.
Yeah, absolutely. And attentiveness as well, like observing things in your
and doing an observation, Yeah. I mean, I don't know if fitness trainers do take people, let's say, stand against the wall and see their postural, on the side or in front. Do they do that?
Some do.
Yeah. particularly in personal training, if you do one-on-one sessions. In group classes, it's obviously very challenging because you have a group scenario. You can't assess people when you're teaching an hour class to 30 people. It doesn't work. And I think when people go to group exercise, they have that in mind. Like, I'm going to a class that's catered at this level.
Right.
It's for everyone. It's not going to be individualized.
Right.
Yeah.
Whereas when you're doing personal training sessions, it's different. You're paying somebody for individual attention, and you want them to be able to do an assessment with you, maybe do a gait analysis, maybe do a full questionnaire and history, and then for that trainer to go, okay, let's meet the following week at these times, and by that stage I would have written a program for you that's suited to your needs, to your goals, right?
Perfect.
Yeah, I mean that's
the ideal scenario.
Yeah, I was gonna say, that's the difference between
An expensive one too, right?
Yeah.
Well, yeah, exactly. That's the difference between a top quality personal trainer who has the experience to be able to, take someone through that whole process, and somebody who's just trying to hit a target in a gym. They might be new from a course.
Right.
They don't really understand the importance of a good consultation until it's too late. So for trainers and coaches to develop themselves, the consultation is part of it, isn't it?
I think it's very important.
Yeah, and also you're not going to be perfect at the consultation the first time you do it. You need to keep going with it, and you need to keep doing it. You need to
Be diligent.
Yeah, like practice the skill of the consultation, because sometimes a client might forget. I've had conversations with people where we get to the third question or the fourth question is any injuries, and they think right now, no, I'm fine. And then you get talking about it, and they go, okay, so tell me what you used to do in the past. Oh, I used to play a sport, but I had to stop because I have my back hurt, and then they'll literally, oh, now that I think about it, I actually my right ankle, and then that's fine. That's all part of it because they have to recall it at their best that they can do. But the consultation takes a while.
Yeah.
It will take a while, but it's also really good, and it's good to do the observation to see there's any deviation in their spine or postural deviations. Well, I'll give you an example. We did this. We worked with about 30 kids in SNF, which is a child development center. So a lot of these kids are obviously quite, they're spastic and they've got cramps and spasms happening. They have autism, ADHD, okay? So it's fine. Their posture's always going to be slouchy. But after you do the treatment, so I don't know whether this works in this scenario where you do the observation, you see the person's, if there's any deviation in their spine, and or how they're standing, their postural, and then do maybe after a 6-month program or something, then to understand whether did it help or not, because we can strengthen our postures. So what we did with these kids, we did aromatherapy massages on them. We did a lot of stretching and pulling, and stuff. And after a while, 6 months later, we took postural pictures again, and each and every kid had changed. So I don't know if this works in the real world here.
I think it does. I think if you've got the ability if you've got the privacy, and if the client is confident enough, I tell people, I don't personally take photographs of people, but I tell them, go home, get a family member, a friend, a loved one to take a photograph of you. So, and then it's on your phone. You keep it in the vault for a few months, and then we'll come back to it in the future.
Well, you guys do like fitness tests. I know for some of the classes that the PTC run, every quarter or so, you guys do a whole fitness test where the whole class does a complete test to monitor their progress, and that's in a group scenario. So it's quite admirable.
Yeah, that's almost like what you discussed at the beginning, the fitness assessment. The gym company that I work with, we just do some squats, some body weight stuff in the space of half an hour. We get a score, we give it to them on a piece of paper, keep that. 8 weeks later, we'll test again. Because sometimes with classes, that gets overlooked. People just come to a class, they go through the run-of-the-mill stuff, and then off they go. Right. And they never really get to assess and get a tangible
I think this will be more for personal one-on-one training, or maybe 2-3 people in a group or something, like a private training.
Well, what's quite interesting, in Australia we have an ethical guideline for fitness professionals, and you have to adhere to that. And one of the mandates on the ethical guideline is being able to keep notes of everything that you're doing. And in that regard, it's really important to, obviously, if you're doing assessments with people and consultation, is to actually write all of it down and keep a record of
Making a case study, basically.
Exactly. So that you have 6 months down the line, yes, this person person, I've logged all of this in, I know what this person's condition is. So if you have any legal issues, you have all of this on record.
Yeah.
And in Australia as well, we actually have to, every session that you take with a person, you have to write everything down, and obviously you sign it off so that they know that this is what you've done. You know, if ever in the future you have a legal case, oh, this person's been
So
injured.
it indemnifies you.
Yeah, of course, you have a record of everything, and it makes you become very diligent about how you practice, because you're like, I need to do the assessment, I need to do a consultation, I need to do all of the following, and it helps also to elevate your professionalism, so people know, yes, I can trust this person, they're doing their job, as opposed to here it's a little bit of a cowboy country.
I think it's cowboy in quite a lot of places. I don't think it's just here. I have like an instilled practice, because my background is originally slightly more clinical. So we had to take notes, we had to assess, you got to write everything down, you got to write every single session down. At the end of the day, you got to put it into the system. So what I found during that is that actually makes my job easier, because I have a track record of everything. So if I need to go back, if I need to check, I can check, and then the intervention that I can make in the future is proper. You know, it's accurate, and then the client sees that, and it makes a big impression on the client when they can turn around and go, how good is this? And I go, well, I have the stuff from 6 months ago, we can check.
Excellent. Yeah, that's really good.
I don't see many people doing it.
I think it's a bit too easy just to take a client through a training program. Just take them in, start them off, get going with them, hopefully that hoping they'll get results.
But Keith, so many people do this, like, just going back to, I have a really similar story to you.
Okay.
Obviously, I've told everyone a million times, so I'm not going to bore you with this, but the same thing, like I went to like 5 PTs with so many injuries, still on crutches, and like some of these people were making me do ridiculous things, and I was like, are you serious? Like, I can't even stand up without crutches, and you're giving me squats with weights. Like, it's ridiculous.
But does it make sense to do something like that, honestly? And that is the reason, again, learning pathology on certain conditions regarding our musculoskeletal system, there has to be basic knowledge to understand that if I did this to somebody, what's the consequences after?
Yeah, I'm
because
make
you're not
them
helping
worse.
you.
Yeah.
Right?
Yeah, well, arthritis is a really big one. So maybe you can impart some light on that. What are some things that maybe PTs need to be really cautious of?
Well, I think they need to know if there's any aches and pains anywhere. And of course, there will be after the classes because your muscles are stretched and, you're doing things like no pain, no gain, right? But before that, if you do a consultation, you need to understand what was the client's condition and what is there any aches and pains really in the body, and to evaluate that to make sure that it's not something more serious than what is being told. I mean, anybody can just come and say to you, I've got an ache and pain, and my right shoulder hurts a bit. Well, what's in it? Did you go and see a physio? Did you go to check it out? Did you have an x-ray? What else is there? To just go deeper and to ask them instead of going and giving them things to do later, and that's going to aggravate the condition and make it worse. Now, with arthritis, if it's in the body, it's obviously it's a progressive disease.
Degenerative.
Yes, so it goes on if you don't tackle it and don't know the root cause of what it is and to eliminate it if possible. Because see, today doctors are going to give you like protocol. They're going to give you anti-inflammatories. They're going to tell you go to a physio.
Immunosuppressants.
Exactly. So, I don't even want to go there because I can keep talking about that the whole day. But if we don't evaluate and know what we're dealing with over here, we can actually make the condition worse. I mean, there's simple things like going back to the nervous system. Let's say a person who suffers migraines. Okay, it's not a condition that maybe fitness trainers need to know about, but still, if you're working with somebody and you suddenly get an onset of a migraine while you're doing a routine class or your stretches or whatever the program that has been given to that person, migraines can be so debilitating that a person actually vomits and has to be taken into a dark area with no sound. And either they have these anti-inflammatory injections to give them. Now, how long can that person continue living with having these kinds of injections? And migraine is really one big condition over here, and there's a trigger to it. The trigger could be even an exercise. So if the person who's doing the treatments or showing them that, okay, I want you to reach your goal, for example, whatever the fitness trainer has come to teach you, They need to know whether the person suffers from headaches and migraines. And again, anything to do with the neck, any certain jerks or movements that happen in the neck can trigger a migraine as well. So that comes under the nervous system. So we are actually covering quite a lot of pathology under each system, specifically made for trainers to understand their clients better.
Yeah.
Yeah, I'm looking forward to seeing the final product.
And I'm still doing it.
Yeah. We've got yeah, I mean, we look forward to that.
Yeah, now we have a bit of a little conglomeration of anatomy and physiology, rehab, pathology. So they're all courses that really mesh very well together, and hopefully are going to give people a foundation to be able to build upon and say, okay, well now I know my anatomy, now I understand rehab, now I understand I understand some conditions that people might present, and then obviously in the future be able to plan their programs accordingly.
Yeah, I think it's the right thing to do. I mean, they need that knowledge.
Yeah, like I was saying before, I mean, a lot of the courses that people do, they have the original courses, they have this knowledge in their mind. They just need to refresh it. They just need to recap it, and they need to, now that people have been in the industry for however many years, when you go through these courses again, you're not hearing the information for the first time, and you can relate it. Oh, this is potentially why that client in the past had headaches.
Right.
Or maybe that's why that client didn't really understand what I was trying to get them to do until the 6th session. So I think that's where these kind of refresher courses come in so useful much later than when you're learning it for the first time. Because now you actually have some real world experience to be able to relate the information, and that will allow retention a lot more than just sitting in a room for the very first time getting fed the info on your original certificate.
True.
What are the take-home points that you hope people will leave your course with?
Well, at least they'll understand the different diseases that people go through, and to try and eliminate that fear of having that disease and maybe not being able to reach their goals in fitness training or something. Most diseases that we have, obviously you're not going to have someone with Alzheimer's disease coming and doing a course or something, or Parkinson's, for example, because these again fall under the nervous system disorders. But you can recognize somebody who has slight tremors. And sometimes there's people who are dealing with that person on a regular basis notice these things. They will not notice it. They may not even feel it, but we can notice it. That's why I said observation of clients or your students are so important, to be able to make sure that, are they okay? Have they had a checkup? Or what's going on? I mean, has things changed? Did they go somewhere? You know, even a mosquito bite can cause you encephalitis and things like that. I mean, come on, there's so many diseases out there. I don't want to scare people with too much pathology, because really there's a lot of stuff out there. But just really sticking to the basic points to understand that, you know, this is what you need the awareness about, and that's it, basically.
Amazing. Well, thank you so much, Sunita, for coming on today, and we look forward to having your course on A Life of Education. So if people want to follow you, how can they do that? What are your channels?
I have a website. It's sunitateckchand.com. Should I spell that out?
Yeah, go ahead. Yeah.
It's sunitateckchand.com. And I have an Instagram page. I have my Facebook fan page as well. So yeah, go ahead. I mean, I put in a lot of recipes and aromatherapy and stuff for people to ward off, you know, getting sick and coughs and colds and stuff. So yeah, you can log into that and have a look at it sometimes.
Excellent.
Amazing. Thank you so much. So we look forward to having you on A Life of Education, and the course is coming soon.
Thanks,
Thank
guys.
you.
Bye.
Bye.